Hi there, everyone. This is Preet, the founder of Embrace Physiotherapy, coming in this month with a conversation around perinatal mental health. The reason why we want to be able to talk about this is just that it's something I see firsthand alongside that physical recovery that takes place for women after giving birth, but also we see mental health challenges sometimes during the pregnancy piece as well, particularly where a mum is a second time mum and they're bringing in perhaps some trauma from the previous pregnancy, and that might manifest not only emotionally but also physically. As a women's health physio, I often see firsthand how physical recovery and mental well-being are completely intertwined. Many of our clients come in for issues around pain or wanting to better prepare for birth, but often we uncover layers of emotional trauma or shame or fear that lies beneath that all. So we want to be able to create a safe space for women to feel like they can talk about perhaps their mental health challenges, whether they are in pregnancy or perhaps even, let's rewind a bit further down the track, perhaps around preconception, through conception, into pregnancy, and definitely in the postpartum period. And I'd like to introduce a wonderful colleague of ours by the name of Radhika. She is a perinatal counsellor at the other clinic in Geylang.
And thank you so much for having me. I'm a mental health counselor. I've been, living and practicing in Singapore for the last 10 years now. So I have my certification from Postpartum Support International, and I love working with women. I love working with the perinatal population, maternal mental health, right from conception all through postpartum. I work with dads as well, and it's so beautiful to be able to help people to transition into this journey of parenthood.
Yeah, absolutely. Because, it's not like a manual we can read, right? To know everything, the A to Z about, whether it is preconception, conception, pregnancy, or the postpartum. And often, we hear from mummies, why didn't I know this? Why didn't someone tell me? And I think because each and everyone's journey is so individual, I don't think it is even possible to fathom every intricate detail or challenge that might arise from such a phase in life. But what I think is really critical is that women who identify distress, or partners that identify distress, that they should know that there's a normal amount that happens and perhaps not so normal amount, and how to identify that and signpost that, and to know the right resources to lean on to help navigate these challenges.
Yes, absolutely. You spoke about a manual. I wish there was a manual, but the thing is, the postpartum period especially is so nuanced. It's so complex, right? It's layered with so many things. Sometimes it's really hard. So, in that context, what I really want to differentiate, Preet, is between postpartum blues and postpartum depression. My patients here, my clients here, they often feel this immense pressure to bounce back. And we know that in Singapore, about 1 in 8 women go through antenatal depression, and postnatal depression affects about 1 in 14 women, though only about 1 in 6 women will actually go out to seek professional help. And these are
Wow.
just reported numbers, right? So we have a huge help seeking gap, which is driven by maybe not knowing where to go, whom to go to, and also by shame and stigma.
Yeah. And I think maybe also just lack of recognition of signs and symptoms, whether it's a healthcare worker, for instance, as well. I think there's just not enough education and training that goes into helping healthcare practitioners identify these signs and symptoms. So it often does take multiple touch points before we're getting a bit more of a complete picture around, how one might be feeling and what they might be feeling as well.
Yes, absolutely. Most women, they'll go to the healthcare provider, and now I'm seeing it getting a little bit better, but they would be told even 6 months down the line, right? Hey, it's just postpartum blues. It's fine. Go relax, spend an evening with your husband, have a glass of wine, you'll be fine. It's going to be okay. But we now know that there's a clear distinction between postpartum blues and postpartum depression. It's postpartum blues are, they kind of peak between 2 or 3 weeks, and then they subside and this happens because of this massive hormonal shift that's happening post-birth. And it's universal. It affects really about 80 to 100% of women.
Wow, that's really common.
Yes, it's really common. So what really happens is, but the clear demarcation is that after maybe about 3 weeks or so, you stop feeling that way. Whereas with clinical depression, it starts somewhere after the 3, 4 week mark. And that is your general clinical depression, but in the postpartum period, right? So, and then it is compounded by so many other factors apart from mood shifts, apart from sleep disturbances, appetite changes, fatigue. You now have the demands of a new baby. You can have difficulty bonding with the baby. You can have hypervigilance of this baby, of the baby. Thoughts like, why did I have this baby? So it becomes much bigger. It's compounded, it's more nuanced, it's layered. We look at the frequency and the intensity of the feelings, the duration of it, how much of the symptoms are interfering with the mom's day. We say if you're feeling this way for about 2 weeks or so, go and see a professional. But Preet, what I notice is that, I trust a mom who says that she's not feeling well. So, I would say just go with your instinct, go with your gut. If you're not feeling well, if you feel something's becoming bigger than what it should be, go and see a professional.
And what kind of professional would that be? Would it be their gynecologist? Because often there's that 6-week check, right? So that's probably an appointment that's already been made and locked in as a potential place to voice your concerns. But I'm often finding that maybe that's not the right port of call in supporting these mums. But outside of that, who are our go-tos for bringing up or raising these concerns?
Your GP, someone whom you have, your family GP, someone who's known you maybe for a while and who knows what you are like without these symptoms. Maybe that's a person to go to. And this is where I strongly encourage all healthcare professionals to, use the EPDS form to screen.
Could you explain a little bit more around the EPDS? For those that don't know what it is, it's the Edinburgh Postnatal Depression Scale.
Yes, you got that right. Yes. It generally assesses for well-being. And it can be used anytime during pregnancy, postpartum. It can be used for dads as well. So generally, I want I want GPs to use it. I want gynecologists to use it. I want pediatricians to use it. Because many times a mom is not going to a GP or a gynecologist, but she's taking her baby to the
for
pediatrician.
vaccinations or weight checks.
Yes.
Colicky,
Absolutely.
unhappy babies, all the appointments are around the baby, but seldomly in that first 2 months outside of that 6-week check. And I would say, and for those mums who do book in for their 6-week postnatal physiotherapy assessment, there's not a great deal of appointments for a mum to support them in their recovery.
Yes, absolutely. A physiotherapist, I would go because I know, Preet, you do these checks where you're looking at their stress levels, you do the EPDS as well. And often when moms come in, what we are seeing is a physical manifestation of their stress and anxiety and depression when they come into you, right?
So just touching on that, when is it anxiety and when is it depression? So you touched on anxiety. So could we please get a bit more clarification around what postpartum anxiety might look like?
So anxiety is the huge concern with postpartum moms, right? It shows up as intrusive thoughts, of thoughts, what ifs, and many thoughts about of harm coming to the baby. And a lot of this is just evolutionary, right? 100,000 years ago, you would be scared of wild animals and predators harming your baby. So it shows up as hypervigilance. It can show up, it can manifest physically as well, like palpitations, shortness of breath, panic attacks, restlessness, agitation, or this feeling like my skin is on fire.
Okay.
Yeah, all of these things, and they're very, very common. And I would want to say, good moms have scary thoughts.
I love the way you put that. Good mums have scary thoughts. It just helps me validate what I was feeling. But, my youngest is now 9 and my oldest is 12 and a half. And as we're going through this conversation, like, hold on, some of these symptoms, I feel like I can relate to them, but at the time didn't have the words or the language or the knowledge myself to know any better. And I think there must be so many women like myself that are going to listen to this and kind of go have light bulbs going off. And
Yeah.
perhaps where things can change moving forward is for those of us who have daughters or sisters, perhaps sharing and keeping an eye out for these symptoms in significant others might help to change the way they navigate their postpartum journeys as well.
Yes, absolutely. And we want to normalize these intrusive thoughts, right? But
Yeah.
that doesn't mean it's not distressing when they occur. Women are highly distressed by them, because these thoughts of harm to the baby are sometimes, what if harm comes to the baby from some external source? Sometimes it's about what if I harm the baby? And that's really
Mm.
distressing. And I have people coming in every day to my clinic talking about this and saying, should I take care of my baby? Is it
Yeah.
okay for
Am I
me to
good
do that?
enough?
Oh, I'm having these thoughts. Will I
Thoughts.
actually
Yeah.
have my baby? And I go like, yes, absolutely. Go ahead and look after your baby. There is no problem. You know why? Because Preet, these thoughts are ego dystonic, which means that it causes you distress. I'm not clinically as worried about it as if those thoughts were ego syntonic. Because if they were ego syntonic, it would mean I'm having these thoughts and I'm thinking, that's a great idea.
Great idea.
Let me do that. Then I would be worried about postpartum psychosis, which happens in about 1 in 1,000 women, I think. So I know that, these kind of thoughts are very normal. And we should be speaking more about it. As you said, share it.
Yeah, absolutely. I think also just if I can maybe share maybe a little bit from my point of view is I often find, it's not often find, I see in my mums who we work with in the postpartum period wanting to be in control
Mm.
because they can't necessarily control their thoughts, but they can control their actions. And so I think they have this unhealthy relationship with trying to control their life because right now it feels like it's so out of control because your schedule is dictated by your baby. Is this something that maybe is related?
Yes, absolutely. Feeling out of control, not being able to let go is related to anxiety. But I also want to say, Preet, postpartum or motherhood really is,
Mm.
yes, it's supposed to be beautiful and you're supposed to have this beautiful addition to your life and to your family and everything. But motherhood is also it's also a series of losses.
Yeah, talk us
Right?
through that.
It's a loss of the way life used to be. It's a loss of what you yourself would have were like. Your body is different. It's a loss of sexuality. It's everything's different. Everything's changed. That's a huge loss in itself. And that can feel really destabilizing. So you see where sometimes the need for control can come in?
Yeah, absolutely. And here we are trying to bounce back.
Absolutely. There's this immense pressure to do that. And then we put on a mask to show everyone that that's what we're doing and we're doing so great. And this is where, Preet, I'm guessing you maybe would see this as well, like body image issues come in.
Massively. Women wanting to be like they were pre-pregnancy. And it's like, hold on, right? You've also aged in that time period. Let's not forget physiological, biological, and all the rest of those changes because, pregnancy is 9 months. Your thought process around yourself and your body and your environment has also changed. Your roles and responsibilities have changed as well, not to mention the hormonal challenges and the biomechanical challenges that you're facing as a human being. Being pregnant and giving birth, regardless of mode of delivery, is no small feat, yet women underestimate that challenge and want to be able to walk through it as if it never happened. It frustrates me as a clinician because we need to acknowledge that we are different, but not different in a negative way. We have evolved, and hence why Embrace came about, because Embrace is about embracing that next stage or phase in life, moving forward, not reflecting backwards on how we were. And there's nothing wrong with that. I think we really need to normalize that we are all changing moment to moment, minute to minute, second by second. And so should our thoughts around our body image and our recovery and our identity as well.
Yeah, absolutely. I'm so glad you brought up the identity piece, right? Because your identity is massively shifting. You have motherhood as a part of your identity now, and that becomes quite big and significant for many women. And the part about embracing this new identity and your body and all of that, we also have to learn to, grieve what was.
Good
So
point.
that's the part about the loss. And then also, what we had fantasized about what motherhood would look like. Maybe reality is not that. And
I
we
know that social media doesn't make it any easier, does it?
no, no. The thing is when, there's a lot of social media when you're a new mom, because there's a lot of breastfeeding and contact naps and everything happening. So, you're stuck in one place, and what you do, you pick up your phone. And so I actually tell moms, don't look at social media, watch
Mm.
TV instead.
Watch a movie, right? That's a
Yes,
great
watch
idea,
a
even from like a neck and shoulder pain perspective, rather than always looking down at a phone and scrolling, looking up and forward's going to alleviate a lot of that tension. Sorry, my physio side got really excited there. But yeah, absolutely. Pull away from looking at some of these, painted realities of fellow women who look like they're doing it all. We have no idea what kind of support or lack of support these women have, do we? And that may be creating unrealistic expectations around your journey and your recovery.
No, absolutely. The thing is, Preet, also we've lost our village. So we are all looking for support, and we are
Yeah.
looking for, what should I do? What's right? I don't want to parent like my parents did. So what
Yeah.
should I be doing? And so, we don't have any option but to go and look at social media. Then when we go and look at social media, because and then it picks it up, right? Like you
Mm.
breathe as a new mom, and somehow Instagram finds out, and that's all you get on, that's all your algorithm shows you. And what happens though is we're scrolling, we're thinking this is all helpful because it's giving me information, or it's giving me advice on how things should be. But maybe about, and I'm not bashing it completely, right? Maybe about 1 in 50 posts is useful, is actually useful. It does give you something to take away and implement. But
Yeah.
you are scrolling through 49 other posts to get through that one, and that's causing enough damage.
It's so true, isn't it? And yeah, to your point, I think it's particularly harder for some of those women who are expats who have left behind a family and a village and a support network. It makes it all that harder to create that environment for you. There's a lot of new things happening, new people, new faces, new experiences, and it definitely doesn't make it any easier.
It's not just the expat women, right? It's also our
Mm.
local women who do have families here, but maybe, you don't get along that well, or it's
Yeah.
really hard to set boundaries, or they're intrusive.
We all face challenges regardless of whether there are expats or whether you're a local woman, because perhaps you've got family that you just can't lean on or don't want to lean on, and that can
Yeah.
be across any woman.
Yeah, absolutely. Or, it's hard. It has become harder. But the thing is, we can create our village,
Mm.
So, and whether it's, so, even if you don't have families to lean on, reach out to professionals. They can be your support system. Your physiotherapist, your GP, your therapist, your doula, your lactation consultant. They can help you. And there is no shame in having, um, a set of professional women as your village as well. Maybe it's the nanny or the helper you've hired, right? And also other moms. I think that is so crucial. When you're a mom, you need other moms to talk to. And
Yeah.
I know you do that because you have, your mom and bub group, and we do that at the other clinic. We have a mom and bub group as well. And it's so important for these women to get together and have these conversations.
Yeah, absolutely. I think that's the way we learn, right? Through sharing of our experiences and asking each other those questions as well. Creating a village has, I guess, become easier through things like WhatsApp communities as well, right? So, yeah, for women who feel a bit lost, if you're not in a WhatsApp community, feel free to reach out. We'd be happy to share with you some communities that we're familiar with. You don't have to do it alone. And as well as, if you're looking for healthcare providers, that can support you, again, drop us a WhatsApp or an email. We're more than happy to share with you our list of recommended providers to help you navigate this transition and journey into motherhood as well. Whether you're a first-time mum or whether you're a second or a fourth-time mum, just because you've had a baby once doesn't mean it may not happen later on with successive births and postpartum recovery periods. Great. Thank you so much for that. So I was hoping we could maybe talk a little bit about birth trauma and navigating unexpected outcomes. I guess, at the clinic, we're starting to see a lot more women book in during their pregnancy to embrace birth. And what do I mean by that? Birth preparation. So come in physically preparing their bodies for pregnancy, whether it's through exercise to stay strong, fit, active, preparing their pelvic floor, learning to push, breathe, position themselves, minimizing their risk of perineal trauma, for instance, and just knowing what to expect on the day. What we're seeing as well as a result of this, which I'm so privileged and so grateful for, that these women do have these health-seeking behaviors rather than coming in the postnatal period to clean things up, is that sometimes when we're, preparing for birth, we may not have that birth that we planned for. And that often, creates a fair bit of disappointment when the birth you planned isn't the birth you had. And that can be perhaps related to birth trauma. How would you work through that with your clients?
Let me first share a little bit of what birth trauma really is. You have after birth, you may or may not have a lot of physical trauma. And I guess that's what you may be seeing. That's what women would come to you with, right? And then there's also the mental trauma of it, which for a very long period of time we have dismissed, which for a very long period of time we have dismissed, or we've just said, that's normal. We've normalized it, right? But we need to know that trauma really is in the eye of the beholder.
Can you help demystify that a bit more for me?
Yes, absolutely. And birth trauma is not defined by the type of birth you've had. It can be vaginal, it can be a C-section, it can be an induced birth, right? But by the experience of the person giving birth. So if you've had overwhelming fear, helplessness, fear of safety for your life, for your baby's life, loss of dignity, this can all lead to birth trauma. And this can manifest in so many different ways. As after birth, it can come as flashbacks. It can come as hypervigilance. It can show up as, I can't leave my baby with anyone else. I have to take care of my baby myself and do everything myself. It can lead to tocophobia, which is, women maybe don't want to have a second baby because they fear birth the second time around.
We're like, we're never doing this again, but here we are. So I just wanted to ask about the birth trauma and, sometimes where we've not had the privilege of working with someone in their first pregnancy, they might come around in their second pregnancy and they want to work on preparing for the birth. And when we're sitting down and screening these women, we might identify there being a level of birth trauma. And when we talk about birth trauma in our clinic, we're trying to decode or debrief on their previous birth around, I guess, more from a disappointment in the outcome, how one might have birthed. There may or may not have been some level of pelvic floor trauma, such as a tear, for instance, or perhaps there was the use of instruments or forceps. And so when women are thrown into the deep end of like postpartum and not had a chance to really sit down and debrief with themselves, because no one's told them, hey, to have a debrief after giving birth, because it's not something that, people are talking about until, someone in your network, like your physio, might ask you to debrief and just to help understand whether there's going to be some underlying emotional trauma or baggage that they might bring into their second pregnancy and subsequent delivery. We are typically referring those women out to people like
Yes.
yourselves because we feel that this emotional trauma may impact physically in that second labor. Can you perhaps share with me what that debrief with a perinatal counselor might look like and how one might benefit from debriefing prior to subsequent births?
Yes, absolutely. Let me talk a little bit about that. So, in your subsequent birth, this trauma carries a heavy weight. And we are not defining what is a big trauma, what is a small trauma. We're just looking at the amount of distress that you're experiencing. Okay, so there is no judgment around that. There's no definition of, hey, I got a first degree tear, so I shouldn't have a huge trauma as a person who's had a fourth degree tear,
Mm.
right? It can, with a second pregnancy, trauma can surface as severe anxiety, hypervigilance, obsessive planning to control the next birth outcome. So, when the birth you planned isn't the birth you had, when you feel that loss of agency, how do you work through that massive disappointment? Right? That is some of the work we do. Some of this, as I said, it translates into massive anxiety, translates into physical symptoms, which is not physiologically related, which you work with. But the palpitations, the flashbacks, maybe all of that. And that debrief, Preet, is not it's not a debrief of, hey, come down, sit in front of me and tell me the whole story of what happened, because I need to be very trauma informed. I don't want to re-traumatize the individual. So we go very slowly. We figure out what is the distress that is it's causing, how it impacts their life. And a lot of times, what I do is I work with EMDR, that is eye movement desensitization and reprocessing therapy, which is a highly researched trauma technique, and it works wonders with many of the women that I work with. But deep dive on that deserves a whole podcast on its own.
Sure, I might just ask a quick question though, because often we get asked, oh, how many sessions will it take? And look, we know that each and everyone's different. Are there a minimum number of sessions in your experience, one might need in order to feel the benefits of the EMDR, particularly for someone that's processing birth trauma that might be impacting their second labor, for instance?
No, I don't have a clear answer for you on that. I've had clients, the EMDR, the reprocessing phase of it, the desensitizing phase, is only one part of the process. Before that, we were doing a lot of resourcing and stabilizing, but because what we're going to be dealing with is traumatic material. It brings you distress, right? So we're going to be working a lot on that. And it really depends on the client. I've had clients who, one or two sessions and we worked through it. And I've had clients who've worked through a lot of it through many, many sessions. Because you see, your birth trauma may not necessarily be just the trauma while you're giving birth. It can be pain management during labor. It can be after birth, how you were treated, and that's traumatic for you. So many layers to it. Sometimes it's such a long, stressful experience that I've had to break it up into many different pieces. But we're getting very technical over here. But yes, there isn't a clear answer. It really depends on the client. But I would say, if you've experienced birth trauma, and if you want to process some of that before you give birth to your next baby, and things, it's come up for you because now you're pregnant and you're worried about how your next birth is going to be, I would say come sooner rather than later.
Yeah, you've answered my question. When would be the right time to come along in that pregnancy?
Yeah, because it will lead to anxiety during pregnancy. So come early, and we can solve through it, and we won't just solve through the actual birth experience, but potentially we'll save you a lot of anxiety through the rest of your pregnancy.
Absolutely. I mean, not everything needs to be solved at the end of the day. There needs to be a sense where women feel safe and feel supported as well.
Absolutely. And we have a lot of the work that we're doing, even if it's not EMDR, right? When it comes to birth trauma, is we're processing the disappointment, the fear, the loss of control, without judgment. We are we are processing the grief of this fantasy birth that I had, that this is what I wanted. Like I wanted to give birth at home, maybe in, but it didn't work out. It didn't happen that way.
Yeah, look, excuse the language, but when we're working with our clients in the prenatal period for their birth preparation, my standard one-liner is, but shit happens. You might have had the most perfect preparation, textbook pregnancy, no pain, no discomfort. You know how to breathe well, you know how to push well, your pelvic floor knows how to have stretch and give and yield. But on the day, there's just so many things that are out of our hands and out of our control. Who's your anaesthetist? Who's your gynae? Did your gynae have a good night's rest? Who are the nurses on the floor with you that day? Did you have an argument or a run-in with your partner that morning because he or she forgot to pack the hospital bag? Your mental state, your stress levels, the physiological and hormonal changes that are happening. There's just so much that's beyond our control, that the reality is it's not about having that perfect birth, right? It's about feeling safe and supported and informed and knowing your options when they need to be challenged, and perhaps there's the need to be flexible in that as well.
No, absolutely. Absolutely. It's feeling safe and supported. And sometimes when women don't have that birth that they wanted, like they wanted maybe a vaginal birth, but they've had to go for an emergency C-section, many of them start feeling so much shame. And that is something that we work through as well.
Yeah, it's so interesting. Wow, we've over-glorified, not over-glorified, but like there's this phrase, have you even birthed if you've birthed via a C-section? Like, women can be mean to women at the end of the day. And I think I just feel like sometimes we're in high school again, and this cannot be happening in this day and age, where we should be entitled to choice and it should be informed. We should be given the complete details and information so we are making those decisions for ourselves. And it's got nothing to do with the person sitting next to us at the end of the day. Yet that person sitting next to us can have so much of an influence on how we feel about ourselves and the decisions we make for ourselves, which I would say is such an ugly part of being a woman.
And this is the toxicity of social media sometimes, right?
Absolutely. When should someone see a counselor like yourself?
I think, Preet, we spoke about postpartum depression, we spoke about anxiety, we spoke about psychosis. This can all happen in the prenatal period as well, right? When you're pregnant, you don't have to have clinical symptoms to go and talk with someone. Adjusting to a pregnancy, adjusting to parenthood is a really hard transition all by itself. So if you just feel like talking with someone, if you feel the need for support, and if your gut is telling you, you're saying, there's something's feeling off. I haven't been feeling like myself for a while. Go and talk with someone. You can try self-care for a few days, eat well, try and sleep well, add some sleep, completely knowing the sleep deprivation that new moms face. But if there are massive changes, can I get support to be able to get some sleep? And we say, we need to get at least a stretch of 4 hours of sleep, one stretch of 4 hours at a time. So can I get support to get that? So when I've gotten that, can I get that? Can I get some movement in, some sunshine in? Can I laugh a little bit? Can I eat well? When I've done some of this and I've tried some of this and I'm still not feeling like myself, definitely go and talk with someone.
I love how you put that. Got a bit of sunshine, can I laugh? Some sounds so simple yet undervalued, and how important just ticking those foundations might be in helping you better navigate these challenges, but also be aware if you've tried that and things aren't shifting, then that's a good indication that now is probably the right time to reach out for more help, and having that conversation with your partner going, hey, I think I need some help beyond you as someone that I can speak to, someone like flag it with your GP or a perinatal counselor. Do people need to get a referral to see you, or can they just directly book to see you?
They can just directly book to see me.
Got it.
There's no need for a referral. Yeah, but having said that, there are referrals that come through, from physiotherapists like yourself, and then from GPs, mostly from their doulas. because a lot of
Yes,
them, are seeing postpartum doulas who are coming in to check in on them and their babies. So yeah.
absolutely. Perhaps this is one for those supportive partners. What are some key things that a supportive partner can do to help alleviate some of that load, whether it's physical, mental, or emotional, in the postpartum period?
There are so many things. One is know and appreciate that, your partner has gone through something huge physically, whether you've given birth vaginally, whether you've given birth with, through a C-section. It's like a huge surgery. And in which other surgery that you would have had that, you would be on bed rest and resting up for a few weeks. You won't like go home and start looking
It's
after.
true. It's so true. Yet we overestimate what we expect of ourselves to be able to achieve after major abdominal surgery. It's so true.
Yeah. And then, you're getting the hang of breastfeeding. You're
Mm,
absolutely sleep deprived. So there are so many things. And, dads and partners go through their own things as well. And maybe we'll speak about that in a minute.
mm,
But how they can support is really understand that this is a significant shift. And these hormones are ever shifting.
yes.
Last a year, 2 years, right? The baby is changing week by week, sometimes day by day. So constantly getting adjusted to the baby, that's a lot. So a level of understanding that this is what's going on for her. And this is sometimes things that I hear, right? But she's not going to work. She is staying at home and looking after the baby. So she should be able to do all of that, right? And manage the household chores. And also this level of expectation that's there, sometimes it's really high and that can feel
And I
unsupportive.
guess having a very clear conversation around expectations, both as a partner and as a mother, I think is quite critical to help support each other. I mean, we're having this conversation speaking to birthing parent, right? But partners, as you mentioned, can also suffer from postnatal depression as well. And we don't want to minimize that either for the partner.
No, no, absolutely. And I'll speak for heterosexual couples, Preet, with the
Mm,
dad. Postnatal depression can show up. It can show up as a lot of worry about finances, right?
mm.
Because if I consider myself to be the provider of the family and I've taken that role upon myself, then I'm worrying about finances. How do I provide for my family? So that's going on. It can show up as rage, as irritability,
Mm.
but I'm really happy to say that a lot of dads are seeking help as well. Sometime last year, and I was really excited and proud about this, was I had at one point I had more dads as my
Oh,
clients than
wow.
moms. So which was
Amazing.
really cool.
Oh, that's amazing. I'm really glad to hear that because often there can be a bit of a bias in this space, right? We're always, because it's the mum that's gone through the pregnancy and the mum that's gone through the labor.
Mhm.
But, there are some amazing partners out there, including mine, who's been there for every wake and every nappy change and every burping session during the night as well. That, yeah, we don't want to forget our partners. Who have supported us in that journey as well.
That they can do as well, right? If take turns at night. If the mom is feeding the baby, you can burp the baby. You can do the nappy
Yeah,
change. The baby's not fallen asleep, put the baby back to sleep.
yeah.
Things like that. And listen to your wife. Ask her what she really needs.
I think this is really important because I think we have expectations on how our partner should behave without us actually telling them. And so when they don't deliver, then that leads to that frustration and irritability. But I think if you just got to tell the partner what you want done, right? Just say it black and white rather than waiting for them to do it, right?
Yes, yes. Absolutely. And for the partners to be curious, not
Mm,
critical. And I would, to that point, not just it becomes sometimes it becomes a chore by itself to keep asking for that help. So partners need to notice what needs to be done. That's
mm.
sharing the mental load.
Yeah, so true. Mental load. What is it? The invisible mental load of motherhood that's being spoken about in social media, trending topic.
True, right? I
It
have felt
absolutely
it.
is.
You have felt it. And there's so much that we're doing that is not noticed. It's a thankless job.
Yeah. I think the hardest part for me has been like trying to articulate that. I can never find the words. And I guess that's why it's called invisible, right? To a certain extent, is that, if I have to think about it and tell you, then I may as well just do it. Why can't you just see it and just deal with it? It's more effort for me to have to explain it to you.
Yeah, absolutely. And then your mental load exponentially increases once the baby is born. And then this mental load it's very high stakes, right? Because this is your precious baby. And then a lot of times what we also see is women who've had previously undiagnosed ADHD explodes.
Ooh.
Yeah, and it becomes too much. All of a sudden, you were able to live life well, and that's all is fine and hale and hearty. Then all of a sudden, you're just overwhelmed and you can't handle things like you used to be doing. And then that shows up as so much rage. And then that can affect your relationship with your partner. So, partners, dads, just start noticing what needs to be done.
Yes, for sure. Yes. Easier said than done, isn't it? Because I think, like we said at the start, there's no book about this. We're not being taught these things, and it's often initiation by fire. And if we're not speaking to each other and we're not learning from each other through having a village, then it makes that even more of an isolating journey, doesn't it, at the end of the day?
No, absolutely. It can be isolating, it can be misunderstood. But also, Preet, I think I'll be doing my clients a disservice if I don't mention this and name it. Is that a lot of this is systemic? It's patriarchy, right? All of this is not. A lot of this is not just your personality that you're a micromanager. These are gender roles. It's what you've been conditioned and socialized to do. This is what you've been given recognition for. You've been shamed if you don't do it, right? So I think we have to name this. Many times in psychotherapy, in counseling, when clients come and there's so much focus on just the individual things, right? Like what can you do? What can you change? But I think I want to change some of that and start naming some of these things that are societal issues. And we have to start naming it to create some of that change or just to normalize and validate some of what we're feeling. I think that's super important so that your feelings are not dismissed and denied.
Absolutely. I think that's well said. Yes, absolutely. Naming it is quite important. And thank you for bringing that to light. I never thought of it like that, to be honest, but as you speak through it, it makes so much sense that we are conditioned to think a particular way. And it's not through our own fault at the end of the day, is it? It's an environmental influence, conscious or unconscious. And it's important for women to recognize that it's not something you're doing at the end of the day either, right? You're not at fault always. Yeah. Thank you very much for sharing that. I think, great point. I wouldn't have thought of it like that. So, yeah, thank you. I guess we often speak of counselors and psychologists and things like that when there's something wrong. Perhaps there's nothing wrong and someone wants to chat to someone like yourself just to kind of get their thoughts in order. Is that something they can do in pregnancy, in the lead up to their birth? A mum can come along and, for a better word, have a chat with you to get clarity on what life might look like moving forward for them. See women who do that and seek your services preemptively. There doesn't have to be anything wrong at the end of the day.
No, absolutely. Preet, and there are lots of women who are now thinking that way. Hey, let me go. This is huge adjustment that's coming up. So let me go and speak to a therapist about it. And we can plan for so many things, right? And especially if someone has a history of anxiety or depression, we can prepare for it a bit, right? We can talk about the couple's relationship. We can talk about how and what I want to do about boundary setting, for example. Post-birth, how do I want to handle my in-laws? How do I want to handle my parents? What kind of support do I want? What kind of village do I want to create for myself? postpartum, and actually even during pregnancy, we talk a lot about going back to work. When do I want to do that? How do I want to do that? Again, what kind of support do I want to get? What will work better for me, given my individuality, given my personality and what I need and want? And of course, things might change a bit post birth, but more or less, these are wonderful conversations to have. That's on one end of the spectrum where nothing's really wrong, but I want to have a chat. On the other end of the spectrum, Preet, are also I have so many women who we've been working together for a while, right, as client and therapist, and then in that journey they get pregnant, and then I get to see them through their pregnancy and then through their postpartum journey as well. So these are women who are already on this journey, right? Then there are women who maybe have experienced some kind of loss, like a miscarriage. Maybe they've had a stillborn in the past, or it's been a missed miscarriage. There are so many different types there.
Women who have had IVF treatments, for instance, as well, where they haven't been able to fall pregnant naturally, and a stigma around that as well, right? Or multiple failed IVFs or IUIs, for instance, as well.
Absolutely. And then there's that anxiety that comes with that, especially with miscarriage, and you're looking at your next pregnancy. So I help women with all of that.
So, Radhika, I'm a little bit confused because we've got therapists and we've got psychotherapists, we've got psychologists, we've got clinical psychologists, we've got counselors. I as a health professional, I am actually confused. How do we know who do we reach out to? How do we know what's the right therapist? Can you please help make sense of this, because it's confusing?
No, absolutely. And the reason it's confusing is because it's not regulated by the government.
Right.
So on a very basic level, I would look for someone who's a psychologist or a counselor who has a master's degree at the very least in this field, right? I would then, the next layer would be, I would see whether they are registered with the SPS, which is the Singapore Psychological Society, or with the SAC, which is the Singapore Association for Counselors. That's my first filter. Right. Secondly, if it is a perinatal or a maternal mental health concern, I would then look for a therapist with a perinatal certification, because that is a whole other kind of training, advanced training that we get. And I think it is very, very important for a person to have that. Usually the certification, this is the only certifying board that we have in the world currently, which is by the Postpartum Support International. So a counselor or a psychologist who would have this the certification would have PMH-C as well. It's really, I think it's really important to have, because as I said, the postpartum period, the pregnancy period, it's so much more complicated than your regular clinical depression, anxiety, all of that. So you need someone who is specifically trained in that. So look for somebody with the PMHC certification.
It's like physios, right? You don't want to go to your postnatal check with a general physiotherapist. You want to go to a women's health physio or a pelvic floor physio to have that check. And I think it's a really important point you make, because not all counselors and psychologists have the same training. We all have our clinical interests and expertise as well. And this is such a delicate period in a woman's life that's only deserving of someone that has that specialist knowledge and skill set to support them.
Yes, absolutely, Preet. And the third layer that I would actually go into is when you go in, give 2 or 3 sessions with your therapist to see, to see the fit. Not everybody says this, but, I'm kind of just spelling it loud. You must like your therapist. There has to be that chemistry. You can't just go because it's good for you. You have to click together, and that sometimes can take 2 or 3 sessions to do.
I think what I usually say to my mums is like, you'll know after the first session if you absolutely do not connect. But if you're sitting on the fence, go for another 1 or 2 more sessions. So you've done about 3 before you really decide, because it is so much about connection at the end of the day. If you don't feel safe, if you don't feel supported, then it's not really going to be of any help to you, is it? Wow, I wouldn't have thought that, but so often it can be confusing perhaps to identify postpartum depression in women, particularly for women who are perhaps older or undergoing a geriatric pregnancy and birth, where it could be perimenopause, or is it postpartum depression, or is it, or you're just stressed and overwhelmed? Like, how does someone like yourself help to distinguish what it might be? Because yeah, women are having kids later in life and it's not as clear cut, is it, at the end of the day?
Yeah. So one of the first things that I do, Preet, is really when women come in, insist on some blood work and get your thyroid levels checked, get your vitamin D levels checked, get your ferritin checked, get your vitamin B12 checked, because these are all interconnected. These are all related to your mental health. And if these are low, and sometimes they can be dangerously low, right? In some of these women, you're not going to feel better unless you fix some of these.
Yeah.
Right.
So
So
the
yes,
first port of call isn't being medicated for depression. It's actually go get some blood work, check for
that's what
these
I would say.
deficiencies,
Yeah.
optimize these deficiencies with your GP or a functional medical practitioner who understands these biochemicals. That can make a world of difference as a starting point.
Yes, absolutely. And if you're perimenopausal, then again, same. There are different blood. There's different tests and there's different blood work that you can look for. But I think this is really important. This is the first thing I would do.
So should they go get that blood work before they see you? Or is there a like recommended order, if it's just like, you know what, just start somewhere? If you know you're not feeling right, just start somewhere, whether it's a perinatal counselor, whether it's your GP, or whether it's your physio and you're just sharing your concerns. Someone with the right training and knowledge can direct you in the right direction that you need to go. And just know that what you're feeling may not always be depression. It might be deficiencies, might be anxiety, it might be depression.
So what I notice is that they may not cause these symptoms, right, of depression or anxiety, but they exacerbate it. And then it feels unmanageable. And sometimes when you fix some of these deficiencies, it suddenly becomes a lot more manageable. And then to your point of support, right? Getting support starts with a conversation. So it doesn't matter whom you go to someone and talk about it.
Absolutely. And that's, so critical, because what we're trying to do is establish a village for women to lean on when they don't have one. And, there's no wrong door at the end of the day. What matters is that you start somewhere, even though women would come to us at the clinic because they're in physical pain, whether it's, they've got back pain from carrying their kid out of the cot or the bassinet, or where they've got neck pain from those marathon feeding sessions. It's often laid with some level of emotional stress because of a change in your status and your roles and responsibilities. And it's so important for people like you and I to collaborate. When we collaborate, we get a more complete picture and women get the support that they actually need. And also it's to support that because multiple people are saying the same thing. And I think that's where the real difference is made to one's well-being, whether it's psychosocial or physical well-being. Thank you very, very much, Radhika, for your time in helping us better understand perinatal mental health. So, Radhika, how can women self-refer to you? What's the best way for women to get in contact with you? Obviously, the clients who we feel that would benefit from your service, we're recommending your services to them. But if someone's listening in and feels that this is something that they might benefit from, how might they get in contact with you?
You can email hello@theotherclinic.sg, or you can contact us by phone, reach us through our website. We'll have someone put you in touch with me and get an appointment.